Hello and welcome to Subang Jaya Medical Center live stream coming to you direct from SJMC. My name is Alan Tay. I'm the host and moderator for today. And today's topic is low back pain. And I will be introducing my colleague, none other than Dr. Chooi Seng, who's a consultant orthopedic surgeon and he's also a triathlete, a triathlete and consultant orthopedic surgeon. So the apt person to talk to you about musculoskeletal disorders. And without further ado, I'd like to bring on stage Dr. Chooi. Okay, so welcome, Dr. Chooi. How are you?
Fine, thank you. Many thanks for the kind words, Dr. Allen. I'm an orthopedic surgeon by training, but my subspecialty is spine. So most of all my work is spine work, and when we talk about spine, we cover from the neck, cervical spine, right down to the tailbone or the coccyx. I think before I start, I would like to make a disclaimer. Of course, low back pain or back pain is a very, very, very big topic, and it has multiple subtopics. So what we are talking today are broad, general principles. And so if you have a persistent problem, it's always a good idea to see your medical practitioner or your doctor to get it sorted out. Okay, so now that we've got that out of the way.
So I'll hand the stage over to you, Dr. Chooi, and this is a question and answer session. So Dr. Chooi is here to answer all your questions you have about low back pain. So over to you, Dr. Chooi. We'll highlight the questions on screen so that you all can see what is being addressed as well.
Thanks.
We'll start with some earlier questions.
Okay, so we can see this is the first question. Okay. This is what I would call mechanical back pain, which means when you're doing a physical activity, the pain comes. And traditionally, it gets better when you rest. So most of the time, these back pains are benign, and it should get better by itself, because a lot of people compare their bodies to a machine. The big difference is our body has the ability to heal by itself. All it needs is some time and rest. So for me, the logical time frame is about 2 weeks. So I would tell the patient to actually take some time off. You can take some painkillers ad hoc. And the way we do it is we also send the patients for some physio that will accelerate the healing process and see what happens after that. If things don't get better, then it's time to go and see your doctor, and you might need to take it to the next step. Okay. If it's muscular, well, generally there will be localized tenderness. That means when you actually apply light pressure to that area, it should be able to replicate your pain. If it doesn't do that, then it can be anything else. And most of the time, that means the structures which are involved are much deeper. Let's say the spine or the joints and ligaments, which are much, much deeper. The muscles actually lie on top of it. And so what happens is sometimes when you have some spinal issues causing back pain, the muscles go into spasm. So that is your body's way to protect itself. So what you're feeling is actually the spasm of the muscles. So you assume that the back pain comes from the muscles. But still, the principle is still the same. Just rest, and it should get better with time. Oh, the fastest way to heal a lower back pain. Rest, and more rest. I know a lot of people are very adverse to the idea of taking pain meds. Of course, there are many sorts of pain meds. You can start anything from paracetamol to anti-inflammatories, or what we call mild to strong opioids. But at the end of the day, the aim is to buy your body some time for it to try to heal itself. So for me, I don't see any issues with pain meds, because you're going to be taking it for a very short term, 1 or 2 weeks before you decide that, okay, it's time to throw in the towel and I'm going to go and see my doctor. So the fastest way, I think, rest. You can throw in some pain meds ad hoc. Okay, this question seems to be a little bit related. Now, the quality of the pain is also is sometimes what we look at as well. When the pain is sharp, yes, it usually means that it is the spine. If it's something that comes and goes and comes and go, what we call colicky, then sometimes that could mean something else. Because you must remember when people when people say that I have back pain, sometimes they assume that it's coming from the back, but of course it can be coming from all the other structures which are near the spine, and so all these structures can give you back pain and mimic back pain. So the best way is to just take some painkillers and rest and see how it goes. If it doesn't get better, go see a doctor. Okay, so you know that you have a disc bulge. The diagnosis has been established with an MRI. They've been given a pain alleviating procedure, and it's called steroid epidural, but the pain persists. Well, when I call this type of procedures spinal injections, and we usually do it under IV monitored sedation. This isn't a cure. This is to break the pain cycle. So with steroids, I would expect a pain relief of up to about 70 to 80%, and this should last about 6 weeks to 3 months. So anything longer than that is your bonus. So for me, I think when you give somebody an injection like that, I normally will counsel them and tell them that this is a short-term measure. This isn't a cure, and expect some of the pain to slowly come back, especially after 6 weeks to 3 months. I know some people will tell you that they've had good relief for up to 1 to 2 years, but that's their bonus. And when you do a procedure for somebody and the back pain persists, or doesn't get better, or it worsens, then there's two possibilities. The first possibility is the diagnosis. We might need to revisit the diagnosis. Number two is if the diagnosis is correct, then next is the treatment option. Was a proper treatment option given? And the third, because this is a procedure, if the diagnosis is correct and the treatment option offered was logical, the third thing you need to think about is execution. Yeah, so was it executed well? So there are many issues that are involved. It looks like a simple question, but there's a few layers to that. Yeah. How to prevent low back pain? Okay, this is a good one. I think posture is the most important thing. There are big guys, there are small guys, but I think posture is the most important thing. And when we talk about posture, we talk about sitting, standing, walking. I do quite a bit of exercise, so I think I swim, bike, and run. So even those disciplines, they have proper posture. That means the way you run, the way you swim, and the way you bike. Posture, I think, is the most important thing. That's why I always tell the patients, when you can see the soldiers standing in the hot sun for hours until end, yes, of course, they're using their skeletal structure to actually do that. If you have a poor posture, then what will happen is you will need your muscles to help keep yourself in that position, and muscles obviously cannot last as long as your joints and bones. Common causes of low back pain. Okay, this one, I assume that we're talking about the benign version of low back pain, because there are many other bad things in life that can give you back pain, but those are not common. So when we say low back pain, I think most of the time we're talking about low back pain, bracket non-specific, which happens to many people. So usually folks like this will encounter back pain from two ways. The first way is you take the typical person who's your typical weekend warrior, who doesn't do much exercise, and then they happen to go to the gym or do something, and they do one huge effort and they get into trouble. The other are those people who do lots of sports and exercise, and it's an accumulated problem, and they've just gone past the volume thing. So these are the two groups of people that I usually encounter. Oh, tailbone pain after childbirth 1 year ago. Okay, this is what we call coccydynia. The word comes from the big word comes from two words. Coccyx means the tailbone. Dynia just means pain. So of course, coccydynia isn't a diagnosis. It just describes the problem. Most of the time, this is benign. Why is it related to childbirth? because there are strong ligaments that are attached to the tailbone, and those ligaments form the hammock or the support at the bottom of your abdomen, the junction between the abdomen and the pelvis, the pelvic floor. That's why you see when some of the antenatal exercises, they'll teach you all those breathing exercises to strengthen the pelvic floor. Now, all these strong ligaments attached to the coccyx, so it is not uncommon to get coccyx dynia after childbirth. But for me, if it persists, any back pain or neck pain that persists after 6 months, you really should have a look at it and find out what's going on. I would suggest go see a doctor and get an MRI. Okay, apart from physio, okay, yeah, this is very common in our setting. I know with chiro and acupuncture and physiotherapy. Let's start off with chiro first, because chiro has some similarities with the physiotherapy that I usually order for my patients with back pain. I think there's no right or wrong answer to this. At the end of the day, I would call these two processes, the physio and the chiro, I would call them external spinal manipulation procedures. And the aim is the same. The aim is to decrease your back pain. So if it works for you, carry on. Yeah. Of course, they may have different philosophies as to how the back pain has come. But to me, I think that is irrelevant. To the patient, when they come to see me, they just want their problem to be addressed. Now, with acupuncture, yes, it's very popular, usually among the Chinese community. But now it has, everybody knows what acupuncture is all about. And it's a well-accepted way of dealing with pain. For me, I think my personal preference is if I can take a tablet of something and it takes away my pain, I would rather that than having needles put into me. But of course, pain also has a very strong psychological input. It's very subjective. It's a subjective interpretation. So sometimes it's not just the act of putting needles into somebody, but it's that strong cultural belief that this will help you, that will also help to address the pain.
I'll just interrupt you, Dr. Chooi.
Yep.
There have been a lot of questions live where you've been addressing questions which were asked earlier.
Yep.
And so that's why I just wanted to switch to some of the live, or do you want to carry on with the questions asked earlier?
Maybe the live ones, because
I think some might get a bit impatient.
Because we should reward the live questions ones, because we are competing with Olympics, isn't it?
Yes. Yeah. Okay. This is a question very similar to your one you addressed earlier from Adrian Leong.
It's not such a remedy for low back pain. Yes, it is. It's one of the tactics that we use, and we call it conservative treatment. That means physiotherapy, because that's readily available in my hospital. I call it external spinal manipulation. Is it administered only by a physio for effectiveness? Well, I would think yes, because when you have a trained physiotherapist, that just improves the chances of doing something properly. But of course, most things can be learned. Yeah, so I would say yes.
Okay. Irene has this question.
Okay, what can be done if back pain is caused by an uneven hip? Well, if the issue of the uneven hips are established and it's confirmed, then you might need to go and see a doctor to address the hips, obviously. I would advise you to go and see a doctor to address the problem with the hips. This is also a common one. Okay. Now, usually when you have a traumatic event and you have back pain after that, if the back pain persists after 6 months, definitely you should get it checked. Now, if the trauma, the index trauma was 2 years ago, and there was a long period of wellness, then there's every possibility that traumatic event may have no relevance to your current back pain. But because of that 2 years, my personal limit is 6 months. Anybody with back pain longer than 6 months, that's not, you need to have it looked at. I would advise the patient to do an MRI. Of course, go see your doctor first. Well, if it's in the middle, is in the midline, that would suggest something to do with thoracic or the lumbar spine, and it goes all the way to the low back. Yep, that sounds like the lumbar spine. What could be the cause? Well, usually sprained muscles. That's the commonest that I find in my practice. If it persists longer than 2 weeks, then you might need to get it checked.
Not sure whether this was answered before.
Yes, this was in one of the questions actually. Will scoliosis trigger low back pain? Scoliosis, I think for some of the folks that are not, who don't know this, scoliosis just means in layman terms, it means a crooked spine. Now, there are many causes for scoliosis. The commonest that we encounter is the type that we call adolescent idiopathic type. So as the name suggests, adolescent means it comes when you're a teenager. Idiopathic means we have absolutely no idea where it comes from. So these are the younger ones that get it. In principle, these are supposed to be painless. If somebody with adolescent idiopathic type scoliosis presents with back pain, that is an ominous sign. It will usually eventually prompt me to do an MRI because we need to exclude the other bad things, or I call it occult pathology. Now, the second most commonest type of scoliosis that we see is in the aging population. We call it lumbar, which means low back, lumbar degenerative scoliosis. So degenerative means it's wear and tear. Now, this one definitely can give you low back pain because there'll be structural and instability issues in your low back or lumbar spine. So when you say, will scoliosis trigger low back pain? Degenerative type, yes, but not the adolescent idiopathic type. If the pain is on the right side, how to know if it's organ related as the pain's been there a while? Oh, that's simple. Now, usually the things that we do, for example, physiotherapy and pain meds, is to address musculoskeletal pain. Let's take, for example, physiotherapy. So if you believe that the problem is from the muscles and or the spinal structures, then it should respond to physiotherapy. Versus, let's say that you have a stone in the kidney. Yeah, physiotherapy isn't going to help. So one way is when you do your treatment and it doesn't help, then it might be something else. It's a bit like if your car can't start and you change your batteries and it still doesn't start, it's not the batteries. Yeah. Oh, low back pain since C-section. Okay. I'm assuming, there's no time frame here mentioned, but just a C-section, I've never seen someone with a pure C-section complaining of back pain as a result of the C-section. I think it may be something that is unrelated to the actual C-section. Yeah, I would get it checked. Yes, the answer is yes. When you have low back pain and the pain seems to radiate to the gluteal regions, the gluteal muscles or gluteal region is the area that we call the buttocks. So that usually tells us that we call the L5S1 facet joint. What's that? That's the articulation between your lumbar spine and the next region of spine we call the sacrum. So it's very famous. The L5S1 facet or the joints pain will radiate to the buttocks. It's your lumbar spine. Okay. To me, physical activity to be encouraged, but in logical doses. Now, when somebody has pain, because I'm an orthopod, so we're talking about musculoskeletal pain. So pain that originates from muscles or your skeletal structure, your bones. The principle of, to me, physiotherapy or to get better, there's three, and it should be in that particular order. The first priority should be pain control. If you're in pain, there's no way you can move. Yeah, control your pain. Usually pain meds, rest. Yeah, you can give an injection just to take away the pain. Second principle is when you've controlled the pain, the second one is try to work on the range of motion. Once you've achieved that range of motion, then go to the third priority, which is strengthening. So for me, yes, physical activity is to be encouraged, but usually during the acute pain, usually the first 1 or 2 days, your focus will be to control pain meds, rest. Yep, back pain after walking, we call it mechanical back pain. We spoke about this mechanical issue the last time. So what's the difference now? To me, there's two kinds of pain that I normally see. One is mechanical and the other one is inflammatory. Now, mechanical back pain is when you do something and you get pain. So with physical activity, when you rest, it gets much, much better. Now, in the majority of cases, this is what happens. Yeah, inflammatory kind of pain is different. Inflammatory kind of pain is when you've had a prolonged immobility, or I mean you just wake up from sleep, you haven't been doing anything, and you wake up in pain and stiffness. That's inflammatory. And then when you start moving, the pain actually gets better. Yeah, it's pretty important to differentiate this from the history that the patient gives you, because then it helps you in your diagnosis. Facet Osteoarthropathy. Okay, big words. Facet just means joints. Joints is when two bones come together. Osteo means bone. Arthro, again, joint. Pathy is pathology. So something is going wrong at the joints of the bone joints. Because in our spine, just a quick one, because in our spine, it's a recurring theme. You have bone, disc, bone, disc, bone, disc. So that is what's in front of your spinal column. At the back, that's where the bone and bone joints are situated. So that is the facet joints. So that means there's some wear and tear in the joints, the bone joints at back. Okay, what's the difference between hot and cold? Usually when the painful episode is an acute one, to me acute means within the first 1, maximum 2 days, then when you cold is better, because cold decreases inflammation as well, and that helps with the pain. When it is chronic, and it's anything longer than 2 weeks, then the heat helps, warm, because that actually stimulates neovascularization. That means the formation of small little blood vessels that helps in chronic back pain. Of course, there are some people with acute on chronic back pain. They'll tell you that I've had back pain for the last 20 years, and it comes and visits me once a month, every month. So when it comes and visit you every month, maybe for the first 12 hours or the first day, and you need cold. After that, you have to take care of that maintenance back pain, warm.
There are a lot of questions, Dr. Chooi, and some of them are fairly similar. So
Yes.
just to the audience, I just want to say that we may have to skip some and then maybe just address the ones which are very similar. Okay.
Yep. Oh, okay. Sciatic pain, the word sciatica refers to pain with respect to the sciatic nerve. The sciatic nerve is a big nerve that runs from your low back, and it runs to the buttock, to the back of the thigh, down to the back of the leg, and to the sole of your foot. So when you say somebody has sciatica, you're talking about this painful sensation or that they feel that is running from the back, through the buttocks, to the back of the thigh, back of the leg, right down to the sole of the foot. Now, this is a classic description, but and it usually means some kind of nerves are being impinged in the spine, but sometimes not everybody will present with this classical thing. Back pain means, to me, pure back pain. Yeah, there's a difference. You will say, why can't somebody have both? Now, our spine serves two purposes. Number one is our spine. When I say spine, I'm talking generally. Let's talk about the low back. Okay, lumbar. So our spine, number one, the first function is a support structure. It's supposed to take the weight of your body. Yeah. So when there's something wrong with the stakeholders involved in the stability of your spine, let's say, for example, you've got a degenerated disc or you've got some wear and tear in the joints in your spine, this will translate to back pain. The second function of the spine is it houses nerves. You've got spinal cords and you've got exiting nerves. When you have nerve impingement in the lumbar spine, generally that translates to leg symptoms because the nerves go to your legs. So they can be mutually exclusive. You can have back pain and leg symptoms, or you could be so unlucky, you could have both back pain and nerve compression equals leg symptoms. Okay, back pain due to lordosis. Now, our spine is not a rigid, straight structure. It has natural curves. So when you say lordosis, you're talking, it's a big word. It means when you're looking at something from the side, let's say your spine from the side, it has a gentle forward convexity. Now, this is common in the lumbar spine. Everybody's lumbar spine should have some form of lordosis. Yeah. The other thing, of course, is your neck. Your neck has a gentle forward convexity. The problem is when you have hyperlordosis or hypolordosis. That means a little bit beyond or a little bit under what is the normal accepted range. So if you say back pain due to lordosis, our lumbar spine is supposed to have lordosis. So you can't blame that on the lordosis. Wow, 38 is a little bit young. And to have osteopenia. Okay, I think a lot of people will say, so what is osteopenia? Now, osteopenia just means the bone density is not as good as it should be. Now, when we talk about bone density, a lot of people will think about osteoporosis. Well, this is not osteoporosis, but osteoporosis is a good way to think about it because whenever we think about complex things, our mind tries to think of a familiar, simple thing that we can relate to. So with osteoporosis, when you're talking about bone density, there are three kinds. One is normal kind of bone density. And of course, osteoporosis. Osteoporosis just means that your bone density is not good, or some people call it brittle bones. Now, there is a category in between normal bone density and osteoporosis, and we call it osteopenia. But osteopenia doesn't mean that you are at high risk of developing osteoporosis. It just means that your bone density is slightly lacking. Now, in a 38-year-old person, be it male or female, I think it's important to get this checked out because osteopenia in somebody who's 38 is not common. To sort out a problem, you need to find out the underlying cause. So I think you haven't got to the answer yet because you haven't found it. Yeah. Yes. Yeah. Well, congratulations. You're going to be a mother. Now, unfortunately, when for my patients who are expecting, there are a few things that happens when you're pregnant. Number one is you put on some weight. That's normal. And number two, you've got all these hormones swimming around in your body, preparing yourself for childbirth. So that makes sure all your joints and ligaments are supple. So if you've had back pain before, these two things will make your back pain even worse. Now, the issue here is because if you're pregnant, the priority should be the baby, followed by mother. Okay. Some people would say it's mother first, then baby, but it doesn't matter. The most important thing is we'll usually sort out the back pain. We'll try all conservative methods during pregnancy. We only think about big things that we can do for the patient after delivery. So for me, rest, some physio. Of course, there'll be lots of things that you cannot do because you're pregnant. Next is pain meds. Now with pain meds, you need to speak to your obstetrician, of course, who's ONG specialist who's taking care of your pregnancy to see if the pain meds that you're going to take, is it okay? So the principle is conservative treatment until after delivery of the safe delivery of baby. Then we'll come back and talk again. Well, 10 years and 3 years ago. So you can see that, so if you are planning to do another RFA, to me, this means that it's doing you some good and you're quite happy with the results. But of course, this is radio. RFA means, for people who might want to, for people who want to know, RFA means radio frequency ablation. You're applying radio frequency waves to generate heat, just like a microwave oven. And the principle is to actually diatomize or to switch off the pain nerve fibers, which are sending the pain signals to your brain. So what you're doing is you're switching on the relay system. Yeah. So this is a very good way of controlling pain. And to me, I'll counsel the patient and tell them that this kind of pain treatment usually lasts for about 6 months. But with continued RFA, 6 months, anything more than that is a bonus. Because after that, the pain nerve fibers actually regenerate. Yeah. But with subsequent RFA procedures, the duration of wellness actually gets shorter and shorter. That's expected because when you actually apply heat to an area, you will hope that most of the heat will do what it's meant to do, but you'll have some collateral damage. Yeah. So, or scarring. This scarring is a kinder word. Don't use the word damage. It scares everybody. So scarring. So what happens is with continued scarring in the area, then the duration of wellness actually decreases and more stiffness in the back. Most patients will describe this when they start moving. They feel that there's something that they're not as flexible as they used to be, especially after RFA. But for me, I think if you're happy with it and it's taking care of most of your pain, and I can see that you've done very well. One is 10 years ago, the other 3 years ago, you have 7 years of wellness. And now you're thinking about, it's lasted for only 2 to 3 months. Yep, but I tell patients it lasts for up to maximum 6 months. So with 2 to 3 months, as long as you're happy with that, that's what you're going to get. Plus EDD, okay. Okay, can a slip disc heal by its own? Actually, yes. Most slip disc or prolapse discs actually get better with physio and painkillers. So as a general rule, most all doctors will try a good trial of conservative treatment. And some people will even stretch that up to 6 months. Now I can see that your MRI was done in 2015 showed some changes, but now you're having big issues for the last 6 months. Well, I will tell the patient, if your symptoms or what you're feeling compared to your previous MRI, if there is a significant change in terms of quantity and or quality, then you might need to do another MRI to see, because this is a progressive problem, it's wear and tear. So perhaps 2015 now is 2021. So in the space of about 6 years, many things can happen. So that's why you are not responding to the treatment that you responded to 6 years ago. Now, and previously the diagnosis was, okay, yeah, that would explain the sciatica. Now for B complex, what is B complex? Lots of people take this, they can even buy it off the counter without a prescription and magnesium capsules. I'm not sure how many, I don't prescribe magnesium capsules for back pain. Now for B complex, what is B complex? B complex is we say it's neuroprotective. Yeah, it's supposed to aid in nerve nourishment. So for me, if there's a for example, if there's a mechanical compression on the disc on the nerve by say a prolapse disc, generally the B complex will not work very well. I think B complex works very well when the problem with the nerve is not a structural one, it is a functional. For example, you have diabetes and you have numbness in your hands and legs. That's not due to nerve compression, it's due to the process of the disease itself, the diabetes. So this is a functional problem of the nerve. For those sort of cases, I think B complex makes more sense. So that's why when you take B complex for a slip disc causing leg pain, you're not going to get much relief. You need to remove the compression. You need to treat it structurally. Oh, okay.
Oops.
So we will take this one? Yeah. Is running a safe form of exercise if there is L4-5 herniated disc with resolved sciatica and back pain? Okay, now we know that if you have a herniated disc, then you might want to try, and you already have a sciatica, but we know most of the time these things get better with conservative treatment, so that's how it has worked out for you, which is good. But if you have a herniated disc, then you might want to try to do exercises which are not so much what we call axial loading. Yeah, when you run, you're actually loading your spine in a greater quantity than if you were walking. So I would, in patients like this, I would advise them to maybe perhaps try another form of exercise, which would decrease the amount of axial loading into your spine. For example, swimming. Swimming is an example. Cycling is also a good one. But of course, cycling, there's many types of bicycles that you can do. Most folks will go to the gym and try those exercise bikes. Then you can sit upright. Yeah, so that one is a good one as well. But then again, I know a lot of, I myself run a lot. And so I think for me, I would tell the patients, it depends on what you want out of your exercise. For some people, they're very passionate about their running and running is their life. Then I will tell them quality of life to me is very important. I would say, go ahead and run. Go ahead and run and listen to your body. Once you start feeling discomfort, I wouldn't wait till pain comes, then it's time to stop. You can break down your running exercises. So let's say, for example, some folks run 10 kilometers at one go. Well, you can break them down to 3 kilometers and rest every 3 kilometers and just carry on. You can still finish 10 kilometers for the day. So if running is your passion and running is your life, go ahead and run. And when it's time to fix your spine, when it breaks down, we'll do the job for you. But if the reason why you exercise is to get some aerobic workout, you just want to be fit, you just want to be a bit healthier, well, why not consider another kind of exercise? They'll be a bit kinder to your spine. Okay, when you have spinal stenosis, that means you have some nerve compression. And when you have weakness in the legs, that to me is a red flag. A red flag means something that is a bit more serious and should be given more attention. When you have nerve compression, the first thing that you feel is a little bit of pain in the legs because the nerves go to your legs. When that compression carries on and it becomes a bit more serious in terms of quantity and quality of compression, then it will develop into numbness. And as it becomes worse, eventually it will be weakness. So weakness is a super red flag for me. It needs to be addressed. Why? Okay, let's imagine this. You have a nerve and there is a disc which is compressing on your nerve, right? So you get symptoms further down the nerve, numbness, pain, shooting-like sensations, electrical-like sensations, yeah? You can fix that by taking some pain meds, do some physio, but you're not addressing the actual compression on the nerve. Now, when we do surgery, the principle is to remove the compression on the nerve. We do not operate on the nerve. So when we remove the compression, I can guarantee you that your problem will not become worse. But how much improvement and how fast, don't know. You just have to wait and see. So the most important thing is you should not wait until you start getting irreversible nerve damage. Once you start getting irreversible nerve damage, then removing the actual compression will not do you much good. So what are the signs of early irreversible nerve damage? Weakness. Weakness is an early sign of irreversible nerve damage. So once you get weakness in the legs, that is a super duper red flag for me. You need to see somebody, you need an MRI. Okay. Okay, John said mopping. Okay. Hey, that's a good excuse not to do any mopping because I also hate to do mopping. And now both of my feet are having very hot sensations. Yes. Okay, I can see that when you actually do your mopping, you actually bend. This is what you've written here. And you also have a background history of low back pain for years. So just these three things for me would lead me to believe that you have something in your lumbar spine. So the hot sensation that you feel in your feet, or mostly a bit of ankle and the lower part of the legs, could be due to nerve compression. It's time for an MRI. Your back pain has been years. Remember, we said 6 months. I think some folks might be thinking, why is this guy going on and on about MRIs? Yeah? An MRI is not a way to treat the problem. It is a part of an investigation. And for me, I always feel that before you can actually tell someone how they can get better, you need to actually do three things. Number one, you need to confirm the diagnosis. You need to tell them what's going on. Number two, assess the severity. Something can be mild, it can be moderate, it can be severe. The reason why you want to know this is because you can give the patient treatment options. And number three is exclude occult pathology. What do you mean by occult pathology? Okay, I have back pain. That means I have some spinal instability. Now, what's causing the spinal instability? So many things. Most of the time it's benign. Most of the time it's just non-specific. But it can also be all the bad things in life. The big C word, infection. Tuberculosis is still quite rampant in Malaysia. Yeah. So this is what I call occult pathology, something that you never thought about. So to me, it's always a good thing when something is not behaving as it should. You need to confirm the diagnosis, full stop.
Okay.
Anterior pelvic tilt. Oh. Answer is yes, but this is very uncommon. Now, why does pelvic tilt cause low back pain? Because we believe, remember earlier we spoke about posture being very important. What happens is, and earlier we spoke about how our spinal structure, when we look at it from the side, we have certain natural curves. So that's called lordosis, it's also called kyphosis in the thoracic spine. When you have a pelvic tilt, that will also influence the amount of lordosis in the lumbar spine, which in turn will also influence the amount of kyphosis in the thoracic spine. Yeah. So answer is yes. Oh, I think this one we spoke a little bit about this earlier. If it's within the first 1, max 2 days, I would use cold. If it's anything longer than that, I would use warm. Oh, yes. Yoga definitely helps a lot of my patients. I'm not a yoga practitioner, so I better not comment. But yes, to me, all these I will classify under the big subset of external spinal manipulation. Yes. And I've been led to believe as well, I'm not a yoga practitioner, but some of my patients who do yoga will tell me that there are those soft type of yoga exercises, and there are those which are a little bit on the hard side. I'm not sure what they mean. But to me, at the end of the day, it's a spinal external manipulation. If it helps you, go ahead. What type of mattress and shoes? Mattress. Okay, I get this a lot. folks will ask me the type of mattress, hard or soft, pillows. Yeah. Now, for me, I think so. This relates to sleep. Now, for me, I think because when I'm not a sleep expert myself, but to me, the way I see it is there's no actual proper position for sleeping. Why? Because if you had something, if you could CCTV yourself while you're sleeping, you will know that none of us actually sleep in one position. We change all the time. And for some folks, sleeping position, folks like to they sleep more supine, face up, some face down, some curled up like a prawn. Yeah, so it's different sleeping positions. And some folks will tell you that they sleep better on a hard floor. Some folks prefer soft mattresses, some firm. So it is so variable. So to me, I don't think it is a big issue for back pain. Shoes as well. Like for example, of course, some folks will tell you that your feet is related to your back. But to me, I don't really think so. Some folks prefer shoes which are well padded. Some folks prefer those that are lightly padded. So it's so variable again. So to me, no. Yes, the short answer to that is yes. The reason being, when you wear a lumbar support, it helps to take away some of the job that your back muscles are supposed to do. So what happens is you're giving your back muscles a prolonged vacation, and so they become lazy. So when it's time for them to start working again, they can't. Then you'll find yourself being unable to wean yourself off the brace. So that's not a good thing. Oh, this is a sensitive question. Okay, does overweight cause backache? Well, then you need to go into definition of being overweight. I guess you could look into all those graphs, that BMIs and all that. But yes, I find I find this subset group of patients who are in their teens, they're young folks in the prime of their lives. Unfortunately, they have 170, 180 kilos. Some of them have some endocrinological issues. They have some hormonal issues, so they present with a lot of back pain. Yes. Okay, I think what is happening is when you feel pins and needles in your knee or leg, that you, to me, I will usually need to exclude any nerves that are being involved. And when the muscles start pulling like that, we call it spasm. So what's the relationship between the muscle, which is more superficial, and the spine? Of course, the nerves are situated in the deeper structures at the level of the spine, but the muscles actually act to protect it. So what happens is when you have some underlying issues in the spine, the muscles go into autoprotective mode and it goes into spasm, and that's the pull that you're feeling. So the pull in the muscles is related to the symptoms in the legs, but it's not causing the symptoms in the legs. If that makes sense. Yes. Yes. Okay. What is osteoarthritis? Osteo means bone. Arthro means joint. Itis means inflammation. So it's inflammation of the bony joints. And since this is about back pain, so I assume it's the joints in your spine. Yes. Is there a cure for that? It's a bit like asking, is there a cure for aging? The answer is no. Without surgery, of course, there are many things that you can do without surgery to take care of the pain. Yeah. And in this sense, I usually use what we call a biopsychosocial pain model. This is how you handle pain. I mean, at the end of the day, if you've decided, okay, I'm not going to do surgery, no matter what, then you're left with, let's control the pain. Now, how do we control the pain? We need to understand how pain comes. There's a biopsychosocial model. Bio means there's something with the biology of it, the anatomy of it. Next is psycho. Pain is a has a heavy psychological component because it's subjective. Some folks, for the same amount of pain, some folks express it more than others, some less. Social is like, for example, let's say you go to a gym and it's filled with all these big, huge guys, and every day you cannot use the word pain in front of them. It's a taboo word. So after a while, mixing around with these guys for a few months, you realize that you're not supposed to use the word pain. So after a while, you don't feel pain. But if you are in a society where pain is readily accepted and expressed culturally, then that also will influence the way you feel pain. So there's many other things that you can do instead of taking. If you don't want to take painkillers, some people will do some meditation. I'm not into those sort of things, so I don't know the details of that. Meditation, and there are specific pain procedures or things that you can do. Meditation is just one of them. And now, among the doctors as well, there is a subspecialty, and they are called pain specialists. So their armament is definitely much more than us, and you might want to pay a visit to them and see what they say. Oh, I see. So here we're talking about back pain relating to the menstrual cycle. Yeah. Yes. Trying to manage this. Okay. Now, for me. Again, I'm not into ONG. Now, if this pain persists beyond 6 months, I will still need to rule out something in the lumbar spine. And then after that, if that is clear, then I will tell the patient that you just need to manage the pain. Because I think if you ask all the ladies out there, not everybody will have significant back pain with respect to the menstrual cycle. So it's always a safe bet to make sure that you don't already have an underlying issue with the lumbar spine, and then take it from there. Oh, okay. Wow, this is a long one. Okay. Yeah, I would expect this. I would expect this to happen. PID means prolapse intervertebral disc. So remember we talked about the spine having two functions. One is the support. Next one is nerves. So the support issues will give you your back pain. If you have nerve issues, they'll give you leg symptoms. And because this is a wear and tear issue, so of course with usage, with time, this will become worse. A lot of patients will ask me, but if it becomes worse, why does it come and go, come and go? Why do I have extremely good days and I feel extremely normal? And why do I have extremely bad days when I feel like I need my surgery immediately? I don't have an answer for that. But this is something that I would expect. Definitely it will become worse with time. And your problem seems to have been there for at least 3 years. Yes. So for me, you just need to manage the pain. Physio, I can see that you've been doing some physio and some back pain. Carry on. And once it starts to become worse or it's not working, then you might need to go back to your doctor and start talking about all the other kind of options that they can give you. Because when you do physio and pain meds, you know that this is a form of control. You cannot reverse aging. You cannot reverse degeneration. This is control. And when that control becomes inefficient, then it's time to think about other options. Oh no, I personally know a doctor friend who's a rheumatologist, and he actually sleeps face down. I have no idea how, but he seems more fresh when he wakes up in the morning. Seems to be breathing fine. Yeah, so you see, sleeping posture is very subjective. Some folks sleep face down. Or we call it prone.
Okay, Dr. Chooi, we are coming up to the end of 1 hour. Very interesting question and answers to and fro. Yeah, I think thank you everyone for your attention, participation. Sorry that we can't address everything. I mean, I had to skip. Okay, my fault. I had to skip some questions because they will look very similar, or they were questions like really you know the type where you really need a diagnosis of to see a doctor sort of type of question. There's a question about the cost of MRI, but I think that wouldn't be appropriate for this forum. But I think if you have more questions at the end of the live session, I think you can still continue to post in the SJMC Facebook page, and then hopefully you'll get some answers there. There is something we would like you all to in the comments on our Facebook page. SJMC would like to understand your interest for future topics. So your feedback is welcome. And your input will be via a link. Okay, you can't click on the link in the video, but you can click in the link in the comments in the SJMC Facebook page. So please help SJMC understand your topic which might interest you for future live sessions. Okay. Let's see if there's any. Yeah, a lot. Thank you, Sir Dr. Chooi.
Thank you very much.
Yeah,
I know we are competing with the Olympics, so it's great that you spend some time with us. And I think all these webinars and all these Zoom sessions from Chooi is one of the positive things. I think it helps us. It shows us that we can actually reach out to the people, but in this way, and it's actually quite effective.
Yeah, absolutely.
Yeah.
I think look at the Olympics, empty stadiums during the opening ceremony, but the show must go on. Life must go on, and we still have our health and physical needs to be taken care of. And I think the best way is to also educate and learn as much as we can from each other. And I think I have certainly learned from this session. On all your Q&As, and I think it's been interesting. So I'd like to, we're coming to 1 hour now, so I think we'll be ending the live session shortly, and we'd like to thank all of you. So, and last but not least, Dr. Chooi for his time and his wisdom and sharing his experience and knowledge in low back pain. Okay. And back pain, sorry, not just low back pain.
Thank you, Dr. Alan, for your help as well.
My pleasure. Please look at, just send your feedback, okay? Because if you want more Q&A sessions like that in the future, please fill in the form in the comment section on the SJMC Facebook page, and we'll greatly appreciate that. So if there's any downside to our session or any criticism, please, we are welcome to hear as well, and we will try to improve in any way. Okay, all right. So I wish you all well. Have a good weekend. Good afternoon, and take care. Stay safe, everyone. We'll end the broadcast now.
Thank you, everybody.
Bye bye.
Bye bye.
Okay.